Okay, so today we're going to discuss about we have here the ABO blood group system. So this topic will be discussing about how our ABO blood group is being produced. And of course here, the mechanism here about the antigen antibody reaction involving here your ABO blood group. So the ABO blood group system was then discovered here by Karl Landsteiner in 1901. And this is your ISBT classification number 001. ISBT stands for International Society of the Blood Transfusion, where I try to assign the number to each of your blood group is a 3-digit number. So for our ABO blood group system, so we have that 001 ISBT classification number. Okay, so the blood typing identification of your ABO blood group here would eventually in the form of your blood typing. And the blood typing, we consider this one as the most frequently performed laboratory procedure in the blood banking. Of course, here you're doing the blood typing even for the checking of your blood to be transfused to the donor and recipient before you try to perform here your blood transfusion as part of your compatibility testing. Okay, we have here different types of your blood typing procedure. So we have here the forward typing, or you call that one as your front typing. In forward typing, you are detecting for the antigen present in our RBC membrane. To detect here the antigen, so gagamit tayo ng antibody as our reagent in the form of your anti-sera. So for the anti-A, anti-sera, this is color blue because of this dye na Typhon blue. Anti-B, anti-sera on the other hand would have here the yellow na color because of the acryflavine na dye. Okay, so we have here the different test result here with the different blood groups as to their forward typing. So if you are type A, then you add your anti-A. These are again your reagent, your anti-sera. So pag nag-blood typing tayo, so dalawa lang naman yan, di ba? Okay, may slide ka. Okay, magdadrop ka ng blood dito, magdadrop ka ng blood dito. In each of this one, okay, lalagyan mo ng anti-A, anti-sera, then anti-B, anti-sera here. So, ganan, A and B. So, in the case, for example, your patient is type A. So, since your type A contains here the A antigen, so, dito siya magpa-positive sa anti-A, anti-sera mo. Kung saan ka nag-drop ng anti-A, anti-sera, we try to detect the A antigen. For anti-B, it will give a negative result, signifying here that the patient would have A antigen in in his RBC membrane. So, that would signify the patient is a type A na patient. For type B naman, so upon addition of anti-A, anti-B, so magkakaroon ng agglutination sa part na anti-B, signifying here that the patient contains the B antigen. For AB na patient, if you add here both the side here, okay, kung saan ka nag-drop ng anti-A, magkakaroon ng agglutination reaction. Magkakaroon din ng agglutination reaction dito, signifying here that the patient contains A and B antigen on his RBC membrane. For type O na patient, so pag nag-drop ka ng anti-A, walang agglutination reaction. Pag nag-drop ka ng anti-B, wala din siyang agglutination reaction. Signifying here that the patient, wala siyang AB, okay, AB and wala siyang ABO antigen. Okay, another blood typing procedure. So we have here your backward typing, or you call that one as your reverse typing. In the reverse typing, you are detecting for the antibody. Antibody in the serum or in the plasma of the patient. Okay, so since you're detecting for the antibody, you are detecting for the antibody. Okay, so ang ating antigen for that ay dapat na antigen. So your antigen here na ating reagent is in the form of your red cell suspension. So maggagawa ka ng known A saka known B na red cell suspension. Ang A cell here, this is a known A na red cell suspension. So coming from, saan galing ito? This is coming from someone na type A. Okay, type A na individual, tapos gagawa ka lang ng red cell suspension using his blood. The B cells, on the other hand, coming from someone na type B. Then you just need to make here the red cell suspension out of the blood of the patient. That become here your red cell suspension of B cells. Okay, your sample here for the patient is not the whole blood of the patient, but rather ang kaniyang plasma or serum. So since you are detecting for antibody, kaya nga ang ating sample dito ay plasma or serum. So again, mag-slide. Pwede tayong gagawa ng slide, pwede din tayong magawa ng tube method. Okay, pwede sa slide, pwede sa test tube. The same way with your forward typing. So mas maganda actually ang ating tube method compared to your slide method. Because in a tube method, pwede natin siyang ma-facilitate ang agglutination reaction by centrifugation. So mas makita natin kung may agglutination reaction or clamping pag centrifuge natin more than your slide na method. So again ulit, procedure for the reverse typing, you just need to drop here 1 drop of the serum of the patient, 1 drop here, or dito 1 drop, 1 drop. Then you add again here A cells. Then we have here the B cells for another tube. Okay, so if patient is type A, so ang type A na patient natin may anti-B antibody. So dito siya magpa-positive sa test tube natin na may ni-add natin ang B cells. So, pag nag-positive dito, signifying here that the patient will have here the anti-B antibody. And that's your type A. Type A patient, may anti-B antibody. Type A na patient, may anti-B antibody. Type B na patient, on the other hand, so dito siya magkakaroon ng agglutination reaction ng kanyang serum or plasma. The one you try to add here, your A cells, signifying na meron siyang anti-A antibody. For AB naman, ang AB natin ay wala siyang antibodies. So, dalawang tube mo dito, upon addition of your A cells and even your B cells, wala siyang agglutination reaction. Signifying here that your AB patient, wala siyang antibodies. Type O individual on the other hand, so dalawa. Pag positive siya dito sa A cells mo, signifying na meron siyang anti-A antibody. Pag-positive siya sa B cells mo, signifying here na meron siyang anti-P antibody. And therefore, type O would have your anti-A, anti-B antibodies. So, anong rule natin dito? Notice here that, okay, antigen here, kung type A ka, mayroon kang A antigen. Pero ang antibody ng type A ay anti-B antibody. So, the same way with your B patient would have here na B antigen, pero ang antibody niya is anti-A antibody. So, anong ibig sabihin nun? So, ang rule natin dito, whatever the antigen, blood ABO antigen present in the RBC membrane of the patient, it try to lock here the corresponding, or the absent, it lock here the corresponding same type of the antibody in the plasma. So, mean to say, pag type A ka, you have A antigen in your RBC membrane, wala kang anti-A antibody. Kasi pag may anti-A antibody ka, tapos may A antigen ka, magka-clump ang ating RBC. Which is hindi naman nangyayari sa reality, di ba? Hindi nagka-clump ang ating blood here. So therefore, ang rule natin, whatever the antigen present sa RBC membrane mo, the same type of that will not be present in your plasma. Signifying here like, if you're type A antigen ka, wala kang anti-A antibody. But what you have is the opposite of that, anti-B antibody. Type B naman, you have B antigen in the RBC membrane, but in your serum or plasma, you have anti-A. Okay, pag type AB naman, okay, you have all the antigens. We have A antigen saka B antigen in your RBC membrane. Pero notice here, ang ating plasma or serum, wala kang lahat na antibody kasi meron ka lahat na antigens. For type O naman, type O individual, wala siyang RBC antigens. Okay, and therefore, sa kanya lahat ng antibodies. Anti-A, anti-B, antibody. Okay, then we have here the relationship between your blood groups. Okay, whether whom to donate, kung kanino ka pwede mag-donate at sino pwedeng mag-donate ng blood sa'yo when you are needing blood for the blood transfusion. For the type A, you can donate blood sa type A and AB na patient, but you receive blood from A and the O patient. Okay, type B naman, you receive blood here. You can donate blood to B and AB patient. Okay, you can donate blood to B and AB patient, and you could not receive blood from B and type. You can receive blood from B and O na patient. AB, you can donate blood only to AB, and you can receive blood from AB and O na patients. If you O patient, universal donor ang O natin, you could donate blood to all blood groups, AB, and O. But you can only receive blood from someone who is type O. Okay, then we have here the principle of for you to check if the donor and the recipient will be compatible with the blood. Like, di ba kanina sa chart natin, may nakalagay doon, sino pwede mag-donate at kanino ka pwede mag-donate. So, for you to check here, kung pwede mag-donate ang patient natin other than your own blood type or the same blood type. Kasi ang rule natin, when you are having the blood transfusion, dapat type specific ang ating donor sa recipient. Pag sinabing type specific, mean to say, whatever the blood type of the donor, that also be the blood type of your recipient. But sometimes you could have another option, only that you need to consider if they are compatible or not based on this principle. So, para maging compatible sila, you try to consider kung anong merong antibody si recipient natin at anong merong antigen si donor natin. Dapat hindi sila pareho. Okay, kung may anti-B antibody ang recipient mo, dapat ang donor mo wala siyang B antigen. Kung ang recipient mo may anti-A antibody, dapat ang donor mo wala siyang A antigen. Kasi pag maganon, kung pareho sila, ang pareho ang kanilang antibody ng recipient sa donor parehong type, magkakaroon ng antigen antibody complex, magkakaroon ng hemolytic reactions. And that's become here your incompatibility. Example here, sample number 1, recipient natin is type B. Again, ang kinoconsider natin sa recipient will always be the antibody. Diba, antibody. So, recipient mo is type B. So, anong merong antibody sa type B? Sa type B natin, meron siyang anti-A antibody. Ang donor natin is type A. Anong ko-consider natin sa donor natin? Ang antigen na meron si donor natin. So, since your donor is type A, it contains A antigen. So, notice here, ang recipient mo may anti-A antibody, si donor mo may A antigen, so magkakaroon ng antigen antibody complex. That would result here to your hemolytic reactions. Kaya hindi sila compatible dapat. Ito naman, okay, magkaibang blood type nila pero we consider this one as still compatible. So, recipient natin is B. So, type B patient would have, since the recipient, ulit ang consider natin sa recipient, antibody recipient. Your recipient here is type B, so meron siyang anti-A antibody. Ang donor natin is type O. Ano ulit sa donor ko consider natin? Ang antigen ni donor natin. Okay, ang type O ay wala siya lahat na antigen. So, safe ang ating blood transfusion. Okay, that's why we consider them as they're compatible. So, yun lang always na remember natin, bear in mind that it's always the antibody in the recipient and the donor's antigen. We need to consider if they are compatible or not. And then we have here the prevalence of your ABO. So, among white and black populations, so type O ang pinakamadami, followed by type A, B, and the AB. But among Filipino population here, so type O ang pinakamadami, followed by type B, type A, and finally we have here, pinaka-rare would be the AB populations. Okay, now we go to your ABO antibodies. Okay, the ABO antibodies considered to be naturally occurring antibodies. Pag naturally occurring antibodies, these are antibodies which are already present at birth. Diba, pag sinabi nating blood group antibodies, your blood group antibodies, na produce tayo ng ating antibody, okay, if that one is not, is not a naturally occurring antibody. Kung antibody natin ng blood group natin is an immune antibody, pag sinabing immune antibody, ito yung mga blood group na nag-develop ka ng antibody because previously, negative ka sa antigen na yan. Like for example, your anti-kel, for example, pag i-develop ang patient ng ganitong antibody, if the patient is previously ganyan. Kel negative ang patient natin nung una, kaso nga lang na-expose siya sa RBC na K positive or KL positive. Paano siya na-expose? Pwede ang pasyente natin, sinalina ng blood, exposure maybe in the form of your blood transfusion or even pregnancy. So, like itong patient natin, negative siya, kaso sinalinan mo ng blood na KL positive or nagkaroon siya naging pregnant ng patient natin, pero ang father ni baby is KL positive. So, ang baby mo ay nagiging KL positive din. So, since ang mother and baby share the same circulation, ma-expose ang mother natin sa ganito. Okay, pag na-expose siya, so therefore the mother develop here anti-KL antibody. And this is the product of exposure. If that antibody is an immune antibody, especially yung mga IgG antibodies natin. So what we have discussed, di ba? So last topic natin, okay, we classify your blood cells here as either IgG or IgM antibodies. So, pag mga IgM antibodies, you have already that one as naturally occurring antibodies. Yung mga IgG antibody, yun yung mga immune antibodies where you try to develop an antibody because of exposure. So, ganito mangyari. But in the case of your ABO, blood group system, your antibody here is naturally occurring antibodies. Meaning to say you don't need to be exposed here to other blood group because at birth, you have already that antibody. And that antibody is being given to you by the mother. Pwede siyang coming from maternal origin. Okay, so paano ka nagkaroon ng ABO antibody? Pwede siya because there are some mga bacteria or mga pollen grains, for example, they try to act here as parang A-like substance or B-like substance. So, pag A-like substance, let's say na-expose tayo sa A-like substance like of the bacteria, pollen grains, then you develop anti-A antibody. Parang ganon. But those are naturally occurring antibodies. Those are naturally occurring na phenomenon. And at birth, you don't need to be exposed by like blood transfusion or even pregnancy for you to develop here your ABO antibody. Kasi pag panganak mo lang, meron ka ng ABO antibodies. And this is an IgM antibody. So, napakalaki niya. It's a cold-reacting antibody, saline-reacting antibodies. And therefore, okay, since an IgM antibody, like, if you try to add, for example, ang donor sa recipient natin, okay, after you add your donor blood, recipient blood, i-mix mo siya, and try to centrifuge, pag incompatible sila, magkakaroon siya agad ng agglutination reaction. Bakit magkakaroon siya agad ng agglutination reaction? Kasi IgM antibody ang ating ABO. Ay napakalaki ng ating IgM antibody. And therefore, makikita mo na agad ang incompatibility in just as first step pa lang, immediate spin ka pa lang, immediate centrifugation pa lang, incompatible na sila agad, makikita mo na magkakaroon na ng clamping. When are we producing here the ABO antibodies? We produce antibodies here during the 3 to 6 months of our life. Sobrang late na. And try to peak here 5 to 10 years old. What do you mean by this one? So at birth, ang antibody natin is coming from your mother pa lang. Hindi pa yon ang totoong antibody natin. Because we are producing a true ABO antibody here after 3 to 6 months pa lang. And tataas ang level niya after 5 to 10 years. And beyond that one, bababa ang kanyang level. So at birth, okay, our ABO antibodies is not produced by ourselves but coming from the mother. So hindi siya ganun ka-reliable. Okay, hindi siya ganun ka-reliable to perform your ABO typing by which you are detecting here for antibody. Ano ulit na blood type ang nagde-detect ng antibody? Forward or your reverse? Okay, it is the reverse typing na nagde-detect tayo ng antibody. Since at birth, hindi ganun ka-reliable ang ating antibody o hindi pa yun ang ating antibody, so hindi ka magpe-perform ng reverse typing pag ang patient natin ay baby or newborn or sobrang tanda ng ating patient. Because again, hindi reliable ang kanilang antibody production pa. Just in the case sa baby, bakit hindi reliable ang kanyang antibody detection? Kasi remember that at birth, ang antibody niyan ay coming from the mother pa, hindi pa sa kanya. Hindi pa true na antibody ni baby because you're just starting to produce antibody at the age of 3 to 6 months pa lang. Then, how about old population? Pagtanda natin, ang antibody titer natin ay bumababa din. Pag bumababa siya, so therefore, it will not also give you reliable na result with your reverse typing. Okay? Because of this one. Okay, remember here, what I've said that your AB antibodies are IgM antibody. But in the case of your type O, ang type O individual natin, through type O we try to produce here anti-A, anti-B antibody, plus meron siyang anti-AB antibody. Because anti-AB antibody is not the same as kinombine mo lang anti-A sa anti-B. This is not a mixture of your anti-A plus anti-B. But rather, bakit din siya mixture? Because you could not separate this one by just an illusion method or adsorption, illusion na method. I mean to say this is not the same as mixture of adding only the anti-A and anti-B as a separate na antibody. In this antibody is an IgG antibody. Remember that our IgG antibody, we describe that one as your clinically significant antibodies. Pag sinabing clinically significant antibodies, or those are antibodies which try to be reactive at your body temperature. So, medyo delikado itong anti-AB, which is an IgG antibody produced by type O individual. This is actually the reason for nagkakaroon tayo ng ABO, hemolytic disease to the newborn. Pag sinabing ABO, hemolytic disease to the newborn is a condition wherein ang blood type ni mother, hindi siya compatible sa blood type ni baby. Okay, it's because here, hindi sila compatible because, because again, you try to consider ulit ang ating recipient and your donor na wherein, ano meron sa recipient, dapat try to check for the antibody, ano meron sa donor natin, you try to check for the antigen. Okay, usually, ABO-HDN nangyayari pag ang mother ay type O. Okay, remember your type O. Ano ulit ang type O natin? Okay, since ang mother ang recipient natin, type O siya, so meron lahat siya na antibody, anti-A, B, and AB na antibody. So, like for example, pag ang father ng baby is type A, since si mother mo ay may anti-A din antibody, so ang father mo type A, okay, that results here to incompatibility. Okay, like for example then, pag ang father mo is type B, ang father ng baby is type B, then the mother is type O, anong merong antibody ulit sa type O? Meron siyang anti-B antibody din. Diba? So, ganun din. Since ang father is my B antigen, magkakaroon ng incompatibility through your ABO-HDN. Kaya, pag ikaw ang babae, if you are type O, so you have a higher chance of having an ABO-HDN. Pag nagkakaroon ng HDN, pwede mamatay ang baby. Pwede siya magkakaroon ng severe hemolytic reactions because of the blood group ABO incompatibility between the mother and the father. So, if you are type O na patient, na female na patient or na babae, so make sure asawa mo ay pinaka-safe type O din dapat. Okay? Okay, then we have here the inheritance of our ABO gene, or our ABO blood group. So, the ABO gene is the gene that try to code here responsible for the production of your ABO antigens. It's encoded in chromosome number 9, and we try to inherit here our ABO gene from our father and our mother as a co-dominant allele. Kasi sabing co-dominant allele, so isang gene, isang set ng ABO galing kay father, isang set ng ABO gene galing kay mother, i-combine natin. We call this one your co-dominant allele. Okay, the other hand, the O gene, so your meron tayong A na gene, may B na gene, and we have also here the O na gene. The O na gene is an amorph na gene. So, pag sinabing amorph, this one do not code here for the production of your ABO antigen. Kasi remember, ang type O natin, wala naman silang antigen, di ba? So, therefore, the O gene is amorph kasi hindi siya nag-express ng ating ABO antigen. And therefore, ang type O natin ay wala siyang ABO antigen. Okay, we have the term phenotype and we have also here the genotype. Okay, the phenotype is the physical characteristics here. So, pag sinabi natin phenotype sa blood typing natin, ito yung result natin. Kung type A ka ba, or type B ka ba, or type O, or type AB. That's your phenotype. But when speak about the genotype, so these are the genotypic characteristics or the genotypic characteristics, yes. Okay, like for example, if you are type A, again, this is your phenotype, di ba? Pa nag-blood type tayo. So, labas na result mo is type A. That's the phenotype. So, but if you are type A, ang genotype mo pwede siyang AA, that's your homozygous for A, or pwede siyang AO, that's your heterozygous for your type A. If you're type B naman, so pwede siyang homozygous for BB, dalawang B, that's your homozygous. Pwede siyang BO, still that's your heterozygous. Pero ang labas na pa din is type B ka pa din. This one, kung ito ang genotype mo AA, labas na pa din A pa din siya. Pag AO, that's your heterozygous, pero ang labas pa din na phenotype is type A. Okay, then we have here the recombination between the mother and the father blood group or blood type could eventually predict here the type of the offspring of the baby. Like again, if the mother's type A, pag type A ulit, ito ang ating phenotype, ang genotype mo pwede siyang AA or AO. Then for example, the father here, type B. Okay, pag type B ang father natin, ito ang kaniyang genotype, BB or the BO. So, perform the Punnett square. Okay, so ito yung mother natin, pwede siyang AA, homozygous for A, or heterozygous for the A. Ang father natin, we have your homozygous for the B, and ito yung father pala na type B, homozygous for the B, or heterozygous for the B and the O. Pero ang phenotype nito, still type B pa din. So, perform here the Punnett square. So, ito yung mother A, combine mo sa B ng father to give you AB. A ulit, combine mo sa B na father, so AB, AB. Or ganun. Ulit. AB. This one is another AB, this one is another AB. So, ito ang magiging combination niya. On the other hand, pag ganito naman sa baba, ang heterozygous natin, type A na mother combined with the AB na father, that's still AB. A ni mother, saka O ni father, that give you AO. O ni father, saka B, that's your BO. And dalawang O, that's your O. So, ano magiging blood type ni offspring or children nilang dalawa? So, pwede siyang AB, pwede siyang A, pwede siyang B, pwede siyang O. So, pwede lahat ng kanyang blood type. Possible siya if your mother is type A and the father is type B. That's how you perform here the Punnett square for you to check here the possible na possible na combination ng blood type ni offspring ni mother and the father. Okay, now we go to your antigens. Okay, ang antigen natin, the ABO antigen, pwede siya makita sa ating RBC membrane. So, meron ka mga antigen dito na ABO. May mga antigen din tayo na ABO na makikita sa ating plasma. Okay, so pwede dito ang antigen natin or dito. The first one, we're going to talk here about the antigen, the ABH antigen in your RBC membrane. Dito sa RBC membrane. The production of your ABH antigen in the RBC membrane is under the influence of your ABO gene. Number 1, kailangan mo ng ABO gene. And second one, kailangan mo ng H na gene. The H gene here is not part of the ABO blood group system, but it tries to influence the production of your ABO antigens. Okay, the H gene is encoded in chromosome number 19 and your ABO gene is encoded in chromosome number 9. So, kailangan nila magtulungan, especially kailangan mo itong H gene for you to express ABO antigen, ABH antigen in your RBC membrane. Our antigen, the RBC membrane, is produced here at an early as 37 weeks age of gestation. So, ang antibody ulit natin, 3 to 6 months pa. Ito, hindi ka pa pinanganak, 37 weeks, okay, nagkakaroon ka na ng ABH antigen or RBC membrane. And full expression of that will be occurring here at 2 to 4 years of your age. So therefore, pag baby ang pasyente natin, newborn or infants, since pag baby or newborn less than 3 months, hindi ka pa nagpo-produce ng antibody, but what you have here are the antigens. Okay, so therefore, ang perform natin na blood typing would be the forward typing. pag baby ang patient natin. Because remember, pag baby, ang napoproduce pa lang nila ay kanilang sariling antigen. Because antibody nila hindi pa sa kanila. And therefore, you should not perform the reverse typing pag newborn ang baby, but rather perform here your forward typing. Okay, so for the production of your ABH antigen, the RBC membrane, kailangan natin ng ABO gene and your H gene. Okay, so mga ito, ABO gene, H gene, try to code here for enzyme. Enzyme ang kinocode nila. I mean to say, pag meron ka nito mga gene, nagpo-produce ka ng enzyme. Ang enzyme ang magta-transfer ng sugar para gagawa ka ng mga ABH antigen. And this sugar, i-add niya sa kanyang parent na structure. You call this one as your paragloboside or glycan. This is your type 2 precursor. Para makagawa ka ulit ng ABH antigen sa RBC membrane, kailangan mo ng type 2 precursor. These are your paragloboside or glycan na tawag. And this one is identified here having your terminal D-galactose and N-acetyl glucosamine is being linked by beta-1,4 linkage.